Hello, greetings everyone, and thank you for joining us for this latest RF breakthrough session on reopening America's schools across our country. I'm really glad that you're with us. I apologize for the delay in getting started. I know with all that's in the news, technical difficulties are perhaps not the most challenging thing we deal with as a society, but it is good to be online, and it's good to be with our community of partners here in the United States and around the world. You know, 1 year ago, we all began hearing reports of an outbreak in Wuhan, China, and it has been a year. And in that year, we've learned a great deal about COVID-19 and about how to deal with the consequences. We know who is most vulnerable to this virus, what it does to our bodies, when and how to test and diagnose the illness, and now how to inoculate against it. We've also learned, thanks to our guests that will speak today, how we can continue to educate our children amid this pandemic. That's important because since March, 55 million students in the United States have missed at least some, if not most, of their in-person school curriculum. The result is that kids are suffering across this country. Data shows that absences are up, test scores are down, graduation rates are likely to plummet this spring. School closures do more than undermine educational outcomes. They also keep kids from getting meals they need, from having protection from abuse and other access to therapy and social services. Late last year, the Rockefeller Foundation worked with our panelists and nearly 150 other experts in public health and education to develop a plan to reopen America's schools for this coming semester. You can read that online, but the main takeaways are pretty straightforward. First, we observed that in-school transmission is not a major threat relative to background community transmission rates. And we see that in all of the places we work, and you're going to hear about that as it relates to Broward County, New Orleans, Colorado, New York City, Rhode Island, and elsewhere in our discussion today. Second, we know that vaccines will unfortunately not be available and effective soon enough to get our kids back into school this spring. And third, we know that before vaccines are at scale, we can take a series of steps to help children and teachers trust that they can return to the classroom safely. You'll hear about those steps today. The plan we've put forth is a practical one, and while it relies on accelerating, in particular, the use of testing to ensure that schools are safe, thanks to a number of efforts made by so many over the past year, America is likely to have as many as 300 million tests available in the month of February, more than enough to support a broad effort to reopen America's public schools. So let's meet our experts. First, Superintendent Bob Runcie is the superintendent of Broward County Public Schools, the 6th largest school district in America, an extraordinary leader, and I'm excited you're going to get to hear from him. Patricia Brantley is the CEO of Friendship Public Charter School in Washington, D.C., also an extraordinary leader and one committed to serving kids here in Washington, where just the events of the last 24 hours have been quite striking and challenging. Patricia Montalvo has been guiding elementary school students, including newcomers to the United States, as a teacher in Central Falls, Rhode Island since 2018. And I'm excited you're going to get to hear from her and her hands-on experience with the testing program and the whole effort to support schools being open in Rhode Island. Jay Varma is the Senior Advisor for Public Health in the Mayor's Office in New York City. Since April 2020, Jay and his team have served as the principal scientific spokesperson and architect for New York City's COVID-19 pandemic response. And that response has become one that so many around the country have been able to learn from, thanks to their publishing important data from large-scale efforts and innovations. Jennifer Avegno is the director of the health department for the city of New Orleans and has been committed and on the forefront of using innovation, including testing, to improve the pandemic response in schools and communities throughout New Orleans. And finally, Mike Johnston is the CEO of the Gary Community Investments. Mike has been a teacher, a principal, a Colorado State Senator, and through COVID Watch has come up with an extraordinary effort to enable Colorado schools to be open, even when background transmission rates in certain communities become quite high. Thank you all for joining us today. Your incredible dedication to this issue and to being real innovators and really committed to keeping schools open during this crisis are paving the way for the rest of the country. And I'm excited that so many of our members of our audience will get to learn from you today. Since we're starting a little late, we'll have to be particularly brief with our comments. But let me turn first to you, Bob Runcie. Thanks for your great leadership in Broward County. Your approach to reopening schools has been exceptionally data-driven, and you've set a very clear set of reopening criteria. Could you tell us how that effort is going right now, especially as this last 3-week period has perhaps created new strains and new stresses and has tested the criteria you've established so far?
Yeah. So, as we look at the whole cycle, we closed our schools back in mid-March, went through a variety of phases, and we know a lot more now about how the virus works and how it's actually impacting our schools. And so what we've been able to do is now move to a phase where we need to figure out how we can bring more of our students back. We started out the school year 100% online. We were very conservative and cautious. Broward County, South Florida in particular, was a area for high spread of the virus. So we continue to watch how that was impacting the community, our hospitals. We looked at our own ability to be prepared and put precautions and safety measures in place. Many of those are things that are defined by the Center for Disease Control. So we opened our schools and our campuses fully and shifted from 100% distance learning to opening our campuses on October 9th. And we had roughly somewhere close to 30% of the students decided to return for face-to-face instruction in our classrooms. We also granted a significant number of what we call health-related COVID allowances and accommodations for our instructional staff to work remotely. That created some significant challenges for us as kids were being warehoused in cafeterias, auditoriums, and media centers to the extent that their teacher wasn't available at school and they were working remotely. We've now moved to what we call phase 3 because we realize we need to get our kids back. Our schools are relatively safe, and I can talk about what we've done to determine that and what the data has shown us. So we are reaching out to our students, and what we found through the course of this year is that there's students out there that are doing well online, but there's far too many who are struggling academically and emotionally. In fact, what we've identified is a number of factors. One is we've seen a significant increase in the number of students earning Fs, the multiple F grades. That's gone up from 4% to 11% in the first quarter of the school year. That's roughly moving from 8,000 students to 20,000 students. We've also seen habitually truant students. Those are students who have missed 15 or more days during the school year. That number has increased from about 1,700 we would see around this time of the year to about 8,200. So the net of it all is that we've gone through some analytics and identified about 59,000 students who we believe are not making adequate academic progress. We've sent letters home over the past week to those families. We are strongly encouraged in them, almost requiring them to send their child back to school for face-to-face instruction. If the parent decides that they still want to have their kid learning remotely, we require them to come and sit down with a principal, some counselors, and sign a document indicating they understand the educational and life risks that are associated with making that decision. So we're really making a big push to get as many of our students back into our classrooms as possible. And that will require more of our teachers to come back into our classrooms as well. So those are some of the things that we've been dealing with.
That's great, Bob. Thank you. I'm going to come back to you in a moment on testing in particular and how you create a safe environment for those kids, that you're really encouraging to come back, because I know you've done extraordinary work on that. I want to go next to you, Pat. Your work in DC has been remarkable. I think a lot of people are following your lead. You've been really focused on learning loss for your students, as Bob just mentioned, the data around his own student population. What can you tell us about what you've observed with respect to learning loss and what you're able to do that you think is effective to mitigate its impact?
So thank you for the question. I mean, a lot of our experience is very similar to what Superintendent Runcie has mentioned. We have some students that are thriving online, but that is not the vast majority of students. What we found is that students have experienced about 3 months of learning loss in reading and in math. That is similar for what is being seen across the district in Washington, D.C., where we're seeing 3 to 6 months. But it does vary, right? Our elementary children in reading aren't suffering as much as our high school students are in reading. In math, we don't see much of a loss on the high school grades, but we do in the elementary and middle grades. And so it's significant. If you think about it and you're a parent and you have a 5th grade student that entered the 6th grade reading on time, we can tell you that that child has likely regressed a few months and is back at 5th grade skills or 5th grade learning equivalent. That's important for people to know because we want our children to be on time, to be able to take advantage of the curriculum, to be able to move forward and to progress. We do see groups of students who are doing well. Friendship runs the only online public school in Washington, D.C. And so our families that were already set up for full-time virtual, they are ahead a year and a half. So think about that. They're ahead a year and a half, while students who have been thrust into virtual, who weren't necessarily ready for it at home, are 3 months behind. What's significant about that is that when we look at our online student population, our traditional online student population, they are also students who have, higher family incomes, higher levels of family education for their parents. So there's a significant equity issue. So what are we doing? We knew right away that we needed to get kids in person in school because that is where they learn best. And we started immediately. We started the school year like everyone else with students who were in virtual. And a week later, we opened our first in-person learning hubs. Those hubs started out with a small percentage of students, just about 3% of our population. And as we built trust with our community, as confidence was built in our calls, we were able to triple that number so that now we're serving just over 10% of our students. And as we go into the next semester, we'll be serving many more. What are we doing? We are bringing learning to our students in person by ensuring that they have the curricular resources, the staff, that they have both in school and at home the technology that they need. We have invested in programs that are helping students to catch up and learn at their own pace and during their own time. We're focused on competency as opposed to seat hours and making sure that students can show what they've learned and they can move on. So those are some of the things that we're doing that we think are critical for our students. I'd also like to mention this. I know that we talk a lot about learning loss, and I know that it's important, but we also know that more than a third of our students report feeling sad most days. More than a third report that they are lonely. We know when we look at data across Washington, D.C. and across the country that while reports of child abuse are lower because you don't have schools where those reports are happening from in person, that we are seeing more abuse happening with children showing up at hospitals or really having devastating consequences. We have families that are reporting much higher levels of hunger for their children because we don't have kids getting meals in person, even though Friendship and many other schools are standing up meal delivery programs or making ways for kids and families to come into schools, at least for the meals. And so it's not only learning loss, it is the loss of school as a site where children can engage with each other, where they're getting their mental health needs met, and they're getting food and they are feeling safe. And so we need people to think about what not having school open means for a child.
Patricia, Pat, thank you so much for that. I think it's so clear from the data and from your all's experience that having schools open is absolutely critical. And Patricia, you are a teacher in Rhode Island in Central Falls. You've managed to use rapid testing, and we're proud of the partnership we have with Rhode Island that has enabled that with the Binax Now test to be open and to stay open. What's the conversation been like with parents of your students, and what are your sort of most consistent concerns and demands right now with respect to feeling safe in a classroom, and the parents feeling like their kids are safe, the teachers feeling safe, and everyone feeling confident that they can return to that in-person environment?
Hi, thank you for having me. So our community was really hard hit by COVID. Most of my students and their families have had COVID already, and they were the first ones to have it because they were working in congregate settings without masks before masks were mandated. So right now, what their focus is on working, on having that job security and housing security. Not all of them are eligible for unemployment and stimulus payments, and school is their only lifeline. And for almost all of them, this was the first time a computer has been in their home. And so technology was not on our side. It was teaching parents, teaching their students how to log on to the different platforms, and we don't have the broadband that we need. We're working off of hotspots, and so students have lost a lot of schooling, and parents need school for their children, so they're ready.
Patricia,
And
just to jump in, has the testing or the do you feel safe as a teacher in the school, and do you feel like there are a few elements of the response in your school that say, okay, this makes me as a teacher feel safe, or this makes the parents of my students feel safe?
Well, the first thing I do want to acknowledge is that our Board of Trustees gave parents the choice. They gave the choice starting day one if their students wanted to be in school or online. And so everybody that's there, their parents have chosen that. The city has made us follow all the guidelines that health officials have set forward. We do distance 6 feet apart. Everybody wears masks. We're kindergarten through 4th graders in my school, and they all wear masks all the time. And data shows and health officials say that schools are not spreaders of COVID. It's the small social gatherings. And with testing is available in Central Falls. It's right in the city. It's free. It's fast. And parents can get tested if they suspect. And they know that kids can't come to school with symptoms. And testing is even in our school. So Rhode Island has today they ran an article that all Rhode Island districts had the choice of periodically testing their students. We had it in our school, and you do see it was I think 12% in the community spread, and it was just 1% in our school. So it's different.
That's great to hear that you have that data, and that the combination of those activities do create that feeling of safety. So thank you for your leadership and what you're doing. Next, I want to turn to Jay Varma in New York City. Jay, so many places around the country, including the Rockefeller program, has benefited from the data you have made available on testing as part of your plan to reopen K through 12 schools. Can you talk us through kind of how you came to the protocols you came to, and what role testing has played in building confidence and safety, and how you think about the relevance of that going forward in an environment where, you know, vaccines are on the way, community rates are relatively higher than they were in the past, and you're responsible for more than 1.1 million kids.
Yeah, no, thank you very much for having us, and we're eager to share our experiences. You know, whenever we talk about safety in our schools, I really try to emphasize that our initial approach to making schools safe for students and staff was built around incorporating multiple lines of defense against COVID transmission. And those initial lines of defense are not about testing. They're primarily about the measures that we know can reduce transmission of COVID in indoor settings. For example, we started with a hybrid learning model, which means some component of in-person and remote learning that allows us to have smaller class sizes and maintain physical distance of 6 feet at all times. We obviously mandate universal masks. We have symptom screening before attending school, and we have improvements in natural and mechanical ventilation. So for us, the question became, what is the added value of testing? And the way I like to think about it is to really be very specific about what is the purpose of your testing. Are you using testing to diagnose disease in individuals who might be sick or at risk? Are you using it as more of a population disease control measure? Like you want to screen everybody at all times because you're trying to reduce the rate of transmission in the population? Or are you using it to get a snapshot, to monitor the prevalence of disease, to guide your prevention efforts? So we really looked at this primarily really in those two of those ways, which is one, to use this as a way to get a snapshot, to understand whether our prevention efforts are working. And the second was to help us with controlling disease, because we know that a testing program that isn't as frequent as the incubation period of this disease is never going to be perfect. So it has to just be an add-on or an adjunct to controlling disease. And we really found that the data that we've collected over time and published on our website, it's also published on the state health department's websites, it's really helped provide tremendous reassurance, I would say, first of us to policymakers that we're making the right decisions, that the efforts that we have put in place are actually working. Second of all, it has absolutely provided reassurance to parents and to teachers that the efforts that we're making really are important and meaningful at helping to reduce onward transmission. I mean, there still remain a lot of challenges and questions. I think people always have questions and doubts. It's hard to implement a program where you're testing thousands of people every day and guaranteeing that everybody has the samples that they want from the tests that they want and the results that they have. But we've really devoted a tremendous amount of effort into it. And I would just say one other thing, important lesson for people to understand is you really also need some administrative innovations at the same time. What's really been critical to us is setting up a centralized hub that includes people from the health department, from education, people that manage city buildings, from our contact tracing teams, to make sure that all of that information is processed and acted on, in the same way that you would run maybe a counterintelligence operation. It's real-time information and real-time reaction.
Well, that's great to hear. Is there a data point that you find particularly powerful to validate the idea that we've heard from others around when community transmission is relatively high, in school rates can be very low?
Yeah, I think what's difficult for us is, we have over 1,600 schools in New York City. Right now, we have only our elementary, our pre-K, and our special education schools open at this moment. We can talk about the reasons for that a little bit, but I would say that for me personally, as an epidemiologist and a public health professional, what I find most useful is to compare the weekly aggregate report of test results. So that's basically all positive tests divided by the population that was sampled. And I consider that what we call in epidemiology a period prevalence estimate. So the period is the week and prevalence is what percentage of your population is infected. And then we actually have to compare that not to the test positivity in the population, because we know that's an overestimate, but really compare it to statistical models. And we actually have at least 2 different models that we use regularly that can kind of estimate that if you randomly sampled the population in the community, what would your percentage be? And what we found consistently is that our prevalence in the school-associated population, that's students and faculty together, is either the same as or less than what you find in the community.
Got it. Great. Thank you. Jen, let's go to you next. You and New Orleans have been a partner of the Rockefeller Foundations since the beginning of this pandemic, and you worked hard to reopen schools starting in September and are now doing the same. Could you share with us some of the concrete steps you took to build and really deepen trust around the strategy to reopen schools, and did testing play a role in that process, or what played the most important role in that process?
Yeah, thanks for having me. Great to be here with my colleagues who are doing such fantastic work. It's a little bittersweet. We worked very, very hard, really starting in March with the public schools and really with the community to lay the groundwork that would allow us to open schools as soon as we did mid-September. That took a number of forms. The district very early on established that, meals would continue to families in need through March and into the summer, which I think engendered a lot of trust and appreciation from the community, and certainly support that, the schools are really going above and beyond and caring about their well-being during this difficult time. They started planning for their roadmap to recovery in early summer, and that was really a collaborative between governmental officials like myself, educators, parents, and diverse community groups to start crafting a way to reopen at a time when we really didn't know a lot about how that would happen, and there were no national standards. Certainly there were folks like Rockefeller and others starting to do the work, but we were really flying without a lot of information. One of the bold things that they did was, and it doesn't sound very bold now, but consider in June and July, is they put in a mandatory mask policy in that roadmap before any of the other state schools did, and that has been one of the best ways to make parents feel comfortable, to make children feel comfortable, and as my colleagues have said, to really make that in-school transmission very low. That was very controversial at the time. Now, of course, hindsight, it's obviously the right thing. The other thing that they did in order to make folks feel comfortable, because there's the science and then there's the practicality and the art, right? The science is what it is, but if the perception among the community, teachers, and parents is that it is not safe, then all the science in the world isn't going to make a difference. And so in order to sort of bolster that confidence, they began a testing program very, very early on. And again, Rockefeller has been very helpful in instrumenting that, so that any teacher, any school, child or staff who needed a test could get one. And we fought very hard as well in the beginning for the open availability of asymptomatic testing for our teachers, because we knew they wouldn't feel comfortable if they just thought they had to go to work sick and only get a test there. We wanted them to have the ability to test when they felt that they were exposed, or really just before starting class. Our first semester was incredibly successful. As Jay, said in New York, we did not have high rates at all of in-school transmission. It was minimal. We're at a really bittersweet point today, because unfortunately our community prevalence just in the last week has really gone up significantly, such that the schools made the very difficult decision to close for at least 2 weeks. Again, I completely agree that the science tells us that being in school is incredibly safe and it is the right thing to do. However, there's sort of the practical nature of listening to teacher concerns, listening to parent concerns, and knowing that with a positivity rate of 10%, whether or not that's the right metric, that the fact of a lot of people walking into school being positive was very frightening to the community. And so, we're hopeful this is just a temporary setback. I think, this was the right decision for now. It was an easier decision because, again, we relied on those relationships we had built in the summer with community organizers, with parents, with teachers, so that it really was a shared decision, and hopefully it'll be a short-lived one.
Well, I certainly hope so too, and maybe we can take hope from what's happening in Colorado. Mike, your efforts there have been really extraordinary at scale, and from the beginning, you've had an approach that was about bringing stakeholders together to overcome some of the fears that Jen just described are playing out pretty intensely right now in New Orleans. So tell us how you did it, and in particular, what's the roadmap for this next semester for Colorado, and if you're willing, for the rest of the country?
I appreciate it. So delighted to be on with all of you, and to all the courageous educators in this call that are doing the leading and the work. Thank you so much. Yeah, Raj, I think our approach was, we thought there was a false choice going into August, which was the options were either you were going to open in person without protections and put people at risk, or you were going to close and have kids be at risk. And we thought there was a better third option, which is how could we find a way to open safely with all the protections we would expect for educators, the same way we would expect for nurses or other first responders. And so we knew that involved three things. One, it involved regular access to testing. It involved symptom tracking, and it involved contact tracing. So we took on all three of those. We partnered with AmeriCorps to bring out 800 AmeriCorps members to help support our contact tracing team at the state level to make it possible to do more aggressive contact tracing. And then we partnered with school districts, and we said, as Jen was saying, that we thought not only should every teacher have access to testing, every teacher should have access to regular testing. So we went to districts and said, we're going to test every single one of your teachers every 2 weeks. We're doing PCR testing. We did our own stand-up drive-through testing sites. We can get results back in about 36 hours. And within a couple of days, we had 25 districts in the metro area all signed up, representing almost half of the students and half of the staff in the entire state of Colorado. That allowed us to partner with districts to, yes, do all the things that Bob described. So social distancing, masks, all of the due protocols and protections you needed, but also regular asymptomatic testing of all of the staff. We opened, many of those districts opened in August, some in September. And as of now, we've done 350,000 tests over the course of the fall with educators. We've seen our transmission rates, to your point, lower than 1%. Most of the time, they've been about 0.5%, even as community spread has risen to 12, 13%. And so that has been a really important step for us. I will say we also saw in December some of the things that Jen just described, which was community transmission rates got so high that while our school transmission rates were low, that some communities felt pressured to close. We are now going into the spring semester, preparing to reopen all those districts, and in part because we're rolling out a new protocol now. One is, yes, we're continuing to test all of our staff regularly. We are now also making available testing of students regularly, and we're partnered with Saliva Direct and their Yale protocol, which means that allows us to distribute tests on school campuses in elementary and middle schools, where we can test up to 20% of the student population every single week on a rotating basis, get those results back in 12 to 24 hours, and provide a path for schools to open and to stay open. We think with this combination of regular access to student testing, regular access to staff testing, plus maintain social distancing and masking, plus important things like setting the bar at close contact for exposure and not cohort exposure. So we have school districts that keep class rosters, which means if there's one positive case in a class of 30 kids, you shouldn't presume to send 30 kids home for 2 weeks. If you know that of those 30 kids, only one child was seated within 6 feet of that child, that should be one student quarantined. And that one student can now test out on day 5, return on day 7, given the new CDC guidelines. So all these come together to create a real path that I think makes it possible for every school in the country with the right infrastructure to be safe and to be open. I'll add one last thing. We've pushed hard here in Colorado that educators ought to be first in line for the vaccine. In Colorado, we have pushed them up to the 1B category, which means we can both provide all the protections we think are necessary in January and February. And we think we have a path to work hard to vaccinate all the educators in Colorado by the end of March. And so we think you have to do both testing, social distancing, masking, and also push hard to accelerate educators in the vaccine line and get the last mile distribution done to get them served quickly.
Well, that's outstanding to hear, and I'm thrilled to hear that Colorado made that judgment that teachers should go first in 1B, or at least be, a focused and targeted community for rapid vaccination, because the role they play is just so critical to our country and our kids. Bob, I'm going to come back to you now and ask you both about the role of secondary transmission in K through 12 schools, and whether that's an issue that has become something you're hearing about and trying to deal with. And just as you look to the future, given that so far data on transmission in schools or secondary transmission has been so low, how do you build the trust you need to keep more of the school population coming to school, or get them in an in-person setting, even as we're right now in this, really dire third wave that the whole nation's experiencing?
Yeah, I think, there are really two stories, I think, that are to take away from what I've heard from everyone today, is that, there's an infection rate, there's a challenge that's going on in the community. In some places, it's as high as double digits. I think we're about 10% now in Broward County. But when you look at what's actually going on in our schools, it's a very different scenario. We've had about 1,300 identified cases in Broward County schools. And as we work with our Department of Health and have done contact tracing on those, maybe about 130 of those 1,300 could be actually possibly connected to a school. And about 70% of those were related to athletic programs. So when you look at what's going on in our schools and you look at the number of students and adults that we have there, it's less than 0.5%. It's negligible. So when we consult with our public health experts, our medical experts, there is no real significant secondary transmission of the virus going on in our schools. And so I think it's a real shame to close our schools when we know of the impact that closing schools will have on students. We know a lot more now than we did back in March when we closed. So we should be keeping our schools open as long as we apply the protocols that we've all talked about, cleaning, sanitation, maintaining our ventilation systems. Our school systems are probably the most disciplined places in our community in terms of adhering to all these protocols. And that is paying dividends and benefits in terms of keeping the transmission rates down. So the biggest challenge that we have, I believe, is fear and misinformation about what's going on. And it's very difficult to get beyond that. When we did our surveys for parents or who was going to be coming back to school, we surveyed parents, and we had about 60% of our white and middle class and affluent parents are like, hey, I want my kid back in school. When you looked at our Black and brown and poor, the number was 60%, the same number, but it was 60%, I'm going to keep my kid out of school. And those are the kids that need to be in school the most. But yeah, those are communities that have been impacted socioeconomically. They typically have health challenges, and there's also the trust factor in what's going on with the pandemic. So what we've had to do and we continue to do is enormous amounts of outreach directly to those parents and families. So our school administrators, our social workers, our counselors are actually calling parents and guardians directly and encouraging them to send their kids back to school. We continue to reinforce the fact that our schools are safe. And in fact, I would argue that our schools are probably safer than some of the homes and living situations that our kids are living in, especially those with housing insecurity and other challenges. So I think at this point where we are in this country, our schools got to be open and they are relatively safe.
Thank you, Bob. That is an important observation, and I think it's true across the country and across most populations. Schools are safer than the background communities in which families and teachers reside. Jay, I'd like to come to you next and just ask you about teachers in particular. New York City has a huge teacher, faculty, staff population for the nation's largest district. What have you learned about kind of screening, testing, other strategies for providing that population with confidence that they can be safe in the school environment? Some of your learnings have been front page news, but I'd love to hear, how do you think about it, and what does that mean for this next semester?
Yeah, no, thank you very much. I think that the experience that all of my colleagues are facing is actually not at all dissimilar from what we're having here. I would just say that, I don't want to overestimate the amount of confidence that exists. I think that broadly speaking, the teachers that have been working in the schools have felt that that we as a city administration have lived up to our bargain. We've made all the interventions that are necessary. We've enforced the distancing and the masks and the ventilation, and then the testing data has provided insight into what's going on, and really helps, I think, to reassure people. At the same time, as everybody else has noted, that people are still shaken, and appropriately so, by this pandemic. So I think what we have tried to do is to have lots and lots of communication. We have this entity that we said, administrative innovation, called a situation room, which provides really rapid response and feedback. We publish our data. We've held a lot of online sessions, not just in English, but in Spanish. We're planning ones in Mandarin to help with both parents and faculty to understand the data that we have, and why what we're saying is not just an ideological conviction, but why it's actually based on evidence. But the challenge is still there. Transmission rates in New York continue to be high in the community. And I think the best that we can do is to really continue to make that data as transparent and readily available to people, and really hope that the vaccine becomes much more widely available, and then eventually provides another line of defense. Even despite the vaccine, I just wanted to herald to everybody, I do think it's going to be challenging in the fall to sort of say that we're going to be able to rely entirely on a vaccine. I think we all have to be realistic about what the future prospects are for a childhood vaccine, as well as a childhood vaccine that could be mandated along with other vaccines. I think most of us realize that that's very unlikely by this fall. So I do think this challenge of testing and providing consistent feedback and data is going to continue to be important.
Great, thank you, Jay. I couldn't agree more with your point about just testing data and feedback being a critical loop of information that builds confidence and enables schools to be open safely. And Pat, I know at Friendship, you are now part of the HHS Binax Now pilot program. And I'm just curious how you're thinking about exactly that point, layering on all the exceptional work you've done to build community and stakeholder relationships. What will this now enable?
So first, there is no
conscientious of our time, so I'm just going to move folks along a little quicker so we can respect our colleagues' time here.
I'll be brief. There is no pandemic playbook, although we appreciate that Rockefeller is trying to create one, and we hope we can contribute to it. The bottom line for us is this: Friendship serves a population that is 99.9% African American, majority at risk. And we know that that is the community hardest hit by this pandemic. And our teachers and our school staff reflect the community that we're in. And so we had to think very critically about what can we do to keep everyone safe, knowing that our parents, our families, our school staff are making the best decisions they can. Frequent, fast, asymptomatic testing is the answer. We are doing all the things like mask wearing, social distancing, but we've also done thousands of tests at this point and had less than a dozen that were positive. So community spread or spread within schools is low. But we haven't had to close one hub, one POB, one school site because of having to quarantine. Of the less than a dozen that tested positive, none had symptoms. And we were able to remove them from our school community. And so we will continue testing, but my hope is that every mayor, every school district will make testing available on school sites as a prerequisite to reopening schools.
Thank you, Pat. I think Mike's example, really across the group here, the concept of asymptomatic screening and catching potentially transmissive adults and kids. My understanding is adults are far more prevalent or more likely to bring a case into the school environment than a kid. but that is a big piece of unlocking trust. And I'm curious, Patricia, in your experience, so much of this is about teachers being confident so that they can return and teach appropriately in person. Do you have any kind of final parting words of wisdom for how we build that teacher confidence from your own experience?
And just going back to school, we're going back on Monday, and testing is available to our community. And I have good relationships with my family, so that's something that will be brought up. I'm definitely getting tested. It's fast, it's free, and I wouldn't want to bring it into school, and I wouldn't want to possibly infect any of my students or my colleagues. So that's what I'll be doing, and hopefully it's available for everybody. And hopefully with that, then you have that confidence that you're going into a school where there are no cases.
Well, that's great to hear. I mean, that is the path forward, together with the vaccine and all the other mitigation strategies. Jen, as I know you're in a period where things are shut down right now, you worked very hard to keep, as you look to reopen, do you think you'll be able to convince key stakeholders that even if background rates, like Mike just said, 10, 12% are high, schools can be safe if you do this package of activities, including the testing? Do you think that is a story that your community of stakeholders and partners will believe in? Or do you feel that's going to be a tough sell?
No, I think so. I think what's helped us is that we have had a very clear shared mission, both as government and as the schools, that we believe, and we have stated publicly many times, that the biggest benefit to our community in terms of both public health and the economy is to keep schools open. And so, as we just announced some new restrictions for the city yesterday, actually, it was very clear that we said we are doing this so that schools will reopen as quickly as possible. What I hope that does is that gives our school staff, our teachers, our families the confidence that this is, we are doing everything we can to support them. And I think it also gives the rest of the community a common shared goal to work towards.
Thank you, Jen. And Mike, I'm going to come to you for the last word, because I'd like all of our viewers to know that the combined insights of the group you're listening to and so many others is available on the Rockefeller Foundation website, where we have published a plan and a proposal to reopen public schools across the country using fast, frequent testing and those types of tools. We encourage all of you to look at it. And we're proud to be working with the Health and Human Services and others to make this a national approach. But Mike, I think you've really demonstrated what's possible if everyone buys into that vision, that these mitigation strategies can work. And you've managed to make a large number of differentiated districts stay open for in-person education through some real challenges in terms of background transmission. So tell us what your vision is for sort of the semester ahead, and what your recommendations are to other states and other districts and other schools based on what you've learned, because I think they are very aligned with the plan that we just discussed.
Thanks, Raj. Yeah, I think if yesterday the country came face to face with the real depth of our political crisis, it also came face to face with the real depth of our public health crisis, right? Silently, yesterday was also the largest record number of deaths and record number of new cases, right? We are in the fight of our generation. And those moments, there are bystanders and there are upstanders. There are people who will go down in history as the ones who led the battle to turn back this great war that we're in the same way that Rosie the Riveter and a generation of women who helped power the factories that won World War II became heroes to this country. The folks who help open and keep open the schools that not just drive our economy, but are the emotional backbones of our communities are going to be the heroes of this story. But we should not send them into battle without adequate protections. We know we have the resources for that now. We know we have testing. We know we have masking. We know we have symptom tracking. We know we have social distancing. We know we have the resources that we need. What we now have to do is make sure we equip people with that. We know we prevented 32,000 outbreaks through regular asymptomatic testing in Colorado. We can do that for educators. Whether that means they have to know that teachers are tested, students are tested, distance is kept, masks are worn, and the vaccines are prioritized. If we can do those things as a country, we ought to be able to open schools, keep them open, and put America back on track.
Thank you, Mike, and thank you to all of our panelists. We're thrilled to be following your leadership, and your leadership right now is making a huge difference for America's school kids, families, and country, and I just hope more people follow. In particular, Patricia, your last comment that you're going back into the school, back into the classroom, getting a test, and you're going to be there for your students. And I'm sure so many others will follow that great and powerful example. So thank you all for being with us. You can learn more on the Rockefeller Foundation website and be a part of our community. We're really thrilled to be working with some of the best, most creative, and most courageous leaders during, as Mike put it, the real test that our country faces right now. Thank you all.
Thank you.
Thank you.